So what all kind of gynecomastia surgeries we do at Divine? The 4DX technique is a special upgradation of the normal conventional technique which has been made by Dr. Amit Gupta. Now, basically, what it means is that the surgery is done in 4 different directions. Now, that is the base level technique which we always do for all gynecomastia patients. It is towards the shoulder, the side of the chest, the lower part of the chest, and even on the other side. Why this is important? Because in conventional technique, there are areas where their fat or gland can be left. Now we, with this technique, ensure that all of the gland and fat are removed except for a little bit under the NAC, and the overall result is so much better. All of these surgeries are always done with Vaser technique, which is the latest technique which really helps to improve the overall outcome and healing for the patient. So even with the 4 directions in which we operate, there is one area which we still don't touch, which is a no-go area in the center of the chest, both sides, the middle portion of your chest. Why is that important? Because this is where all the blood supply and nerve supply comes from. So once we maintain that, the overall shape is much more aesthetic, and plus there is a lot of security which is given to the blood supply of your chest, especially the nipple, and the sensation as well, which elsewhere sometimes gets missed, and there is a relatively higher chance of damaging these vessels and nerves in a normal conventional surgery. That is why the base level of surgery which we do at Divine is a 4DX technique with Vaser. Now what Vaser would actually do? Vaser basically helps to smoothen out the entire process, and the biggest advantage is that it allows a lot of skin contraction to also happen. Now, if you would understand, which all of us know, that once there is some volume in the chest, we take it out, the skin is going to become slightly loose. Now, for that skin to fix itself will take a lot of time. It will happen naturally, but it'll take a lot of time, and maybe sometimes it not even fully. But what Vaser would do, it'll start a lot of collagen production and make the skin much more tight with the development of more collagen, and that is what really helps to make the shape overall much better. So that is why Vaser is a very good technique to add on to your gynecomastia surgery. The third technique we do is a 360 square technique. Now basically what that means is once the 4DX technique is done, the gynecomastia is treated, we make the outlines of the muscle and then in strategic places add on a little more processed fat. Now what that does is, it, as you can see in this picture, a very good athletic, muscular, enhanced chest is made. This is what you can see right after surgery, and as you can see after a few months, it holds the shape very well. Now, once the patient starts to work out, it becomes even better. So once you see this chest pack has been created, a lot of patients would also opt for a complete transformation. And since it is the same surgery, it can be easily done. So as you can see, a chest pack can also be coupled with a six-pack surgery. And this is what the patient would look like. Also, if we were to go another step further, we can also treat the arms, the deltoids, biceps, and triceps. As you can see, this patient has completely transformed from looking from an average body to an extremely well-built muscular body as well. Obviously, this means that the patient has to work out a little more to maintain all of this, but you can see how much surgery can also help you to achieve the dream body you want. For any other details, please do contact.